All right, what's going on, everybody? Coach Willis here from Willis Performance Training, and I'm joined by a very brilliant guest, Dr. Branden Evans of Cobb Pain and Wellness. Dr. Branden, how are you doing?
I'm good. I appreciate that. You speak too highly.
Uh, he,
But
no,
good morning, man. I appreciate it.
Absolutely, absolutely. So, Dr. Branden here, we've known each other for, since 2013, I believe
It's
it
been a
was.
while.
Yeah, 2013.
Yeah.
So 7 years. I was young in the game. Dr. Branden was the wise, the go-to guru then. So he's really helped me a lot, and from what I do from a coaching standpoint, but just business wise too. And he's always spreading knowledge. But Dr. Branden, I'm going to give you the floor and let you communicate to people what you do and how long you've been doing it and where are you doing it.
Okay. Well, Dr. Branden Evans practice is in Marietta, Georgia. Cobb Pain and Wellness Clinic, about a half a mile from Kennestone Hospital. I've been here since 2008, I believe. It's been a little while since we've been here at this office. And so been in practice since 2004 and graduated from Texas Chiropractic College and just trying to help people out with all kind of different conditions. Over the years, we've talked about all different types of issues from neck pain and back pain and headaches, sports injuries, car accident injuries, and now here we are again, trying to spread some more knowledge and talking about immunity and immune systems and things like that. So I appreciate you inviting me on to just share some more information with everybody.
Oh, absolutely. Thank you for coming on and speaking on the talk of immunity yesterday in our virtual business networking meeting. You gave a really good presentation about, getting adjusted and how it, helps the immune system and what it can do for the immune system, not necessarily prevent anything or keep you from getting sick, but could potentially like help the recovery process. How are those two connected, getting adjusted and your immune system?
So basically, the whole premise with chiropractic is to make sure that your nervous system is working at its most optimal efficiency all the time. And when you have any type of interference in the spinal column, um, based on the bone alignment being out of place, putting pressure on the nerves, those nerves are supposed to be sending signals from your brain and to all your different organs, all your muscle tissue, and just telling your body how to function all the time. And so if you have any interference whatsoever, that means that function can't take place as best or as clearly as it could. It's like being on a choppy phone call. When somebody runs through a bad area, you can't hear what they're saying. And so the chiropractic adjustment helps to make sure that individual's body is just functioning at the best possible scenario that person can function um, function with. And so that's what the chiropractic adjustment can do. That's what things like how you're helping people with the exercise routine can do. When I talked yesterday about it, you mentioned um, eating a certain way. All of that helps to make sure that you can just operate at your best level. We're not trying to cure or fix anything per se. We're just giving your body the best chance that it can have to fight for you. That's kind of like what it is all about.
Mm-hmm. It makes perfect sense to me. I know that everyone who is familiar with how, chiropractic works, they have their ideas of what it is from, what they've heard. And
Mm-hmm.
you mentioned chiropractic to someone, and they might say, well, I don't like my neck getting cracked, or I don't like this, happening. There's always been that debate between, what a chiropractor can do, and then you have the other side of the spectrum, like someone their idea of like a traditional doctor and then what they do. There's like that constant. There's like that battle, that misunderstanding. Like when people initially come to you and they have, or if you're having a conversation with someone and they already have their idea of what chiropractic is, and they might have certain fears. What do you tell those people? like about what you do and how what you do can help them?
Well, I just have a conversation. Basically, it just like everything, it always comes down to communication. And so once I start to explain to people that um, it's not just about getting your neck popped or your back being cracked, and explain what's going on, um, and how even there are different ways to do the adjustment without doing very manual type of adjustments. And so because some people, they'll come in the office and they want a very physical manual adjustment. They want to hear something pop. They want to feel something being cracked and adjusted. And then I have patients on the other end of the spectrum to where they're like, I don't want you to twist my neck at all. I don't want to feel that. I don't like the experience when that happens. I say, okay, that's no problem. It's not about just doing it that way. There's a lot of different ways that I can do my job as a chiropractor to make sure that they are leaving the office, one, feeling a lot better than how they came in, and two, that their body is functioning better than they came in as well. Which is the part where the education comes in, because a lot of people don't realize what's happening on the inside. They just feel a
Mhm.
certain way and they know they want that feeling to change. But as far as where I am, I'm not just making sure that you feel better, because that's kind of like on the surface. That's how you feel is on the surface. There's a lot more going on in your cells and in your tissues and everything that is where I'm more focused on the healing that needs to take place in the body so that they can feel a little bit better at the end of the day too. So when it comes to the conversation of like, well, what does a chiropractor do compared to the medical doctors and everything, and the gap that's in between there, the same thing, communication. So I have quite a few medical doctors that I have relationships with where we refer patients back and forth all the time because they understand what I do. I understand what they do. We trust each other, and I communicate that to the patient, and it helps to bring down the barriers that are there for the doctors that are open to sharing patients. And in the community, there's just a ton of different misconceptions and myths that are out there. And so, when someone comes in or if they call and they are hesitant to come in, then once we have a conversation and I just can get a chance to explain to them what exactly it is that I will do and also what I won't do, and the reason why I would send them to one of the medical practitioners that I work with, then they're usually all on board. And the whole wall that was there before, they kind of realized like, wow, I didn't know that it was like that. They were just going off of what they've heard, not actually speaking to somebody that is, in my world and explains everything to them the right way. And then once that's done, then everything is good. I kind of touch somebody and then they'll tell somebody else and they tell somebody else. And then that's kind of how the word gets spread and kind of align, if you will, for what is really the truth about what we do.
That makes sense. And speaking of touching and being spread, how has the current, coronavirus ordeal impacted how you're managing or running your practice right now?
Um, it's definitely heightened the awareness for everybody that comes in. Um, for us, who are here in the office, we definitely have started taking a lot of time to make sure that everything is sanitized a lot differently, not just ourselves, but the equipment, the tables that the patients lay on. Um, Social distancing is happening in the office too. So whereas before we might have a bunch of people in the waiting room, it's kind of transitioned to, if there's a few people in the waiting room, we will tell patients to just hang out in the car. We'll call or text you when it's your turn, basically. And then so that you're not coming in contact with a lot of people back and forth like that. And then that also gives me time to properly disinfect the table, wipe everything down, um, wash my hands and sanitize myself again. Like, just doing all the things it's really common sense, for what we should be doing. We should have been washing our hands all the time anyway, just those type of basic procedures. And so, but now it's just, of course, in the forefront of everybody's mind. And so that's on the biggest scale, that's kind of the biggest thing that has changed, just how we kind of manage the flow of the patients. And there's different time gaps in the schedule now where instead of just going back to back to back to back to back, go back, then it's like 15 minutes of downtime to just do all that sanitizing and cleaning, washing hands and everything before the next person can come into the office. So that's been the biggest change for us here.
Makes sense. And do you see the pandemic having any type of long term impact on the chiropractic industry at all? Like as far as how businesses might be run from here on out? Because personally, I don't really see things getting back to normal per se really anytime soon. And when it does get back to the new normal, I feel like there's going to be a lot of changes that are going to be made or implemented for certain business industries. What kind of impact do you see this having long term in chiropractic?
Long term for chiropractic, I don't really, as far as like the day to day operations, um, we will probably, like I said before, we're just more aware of making sure that everything is sanitized and cleaned and all those type of things, which we were doing before. It just wasn't as with as much as intention as it is now, because the last thing we want is for someone who comes in and then somebody gets sick because of somebody else or whatever, and you don't want that to happen like on your watch, basically. So but as far as like after all this kind of settles down and goes away, whenever that's going to be, and it's hard to even say when that's going to happen because we get a lot of different information from the different agencies that are telling us what's going on. But at the end of the day, nobody really can predict it because it's a virus. And so it can spread, it can go dormant for a while, it can come back. So I think that in the near future, the biggest impact is going to be how can things get back to normal and what's going to happen when they release like the state of emergencies that we're in and all that kind of thing, and people start to move around a little bit more going into the summertime, and how things going to be going into the fall, because I understand they're predicting that there might be another surge of cases coming back around once the fall season comes. So we're just kind of watching everything with a watchful eye just to see like how it's going to play out, because nobody knows. You can't predict for it. And so we just got to operate kind of the way we are. I feel like though now what we're doing is like how things have settled in for right now. I feel like right this level of society for right now is kind of like how business will operate for us anyway here at our office. With doing the patient flow and how we're doing everything. I think that that's kind of how it's going to be for a little while until things start to get back to a little bit level of normalcy.
We'll see. Hopefully, everything will play out for the better for everybody. But definitely,
Yeah.
there's going to be some type of adapting that'll take place across industries, especially in mine. Um, but actually, yesterday in your presentation, you mentioned you talked a little bit about the difference between a virus and was like a bacteria infection. How different antibiotics can only do so much. Like there's a lot of people who don't know that. You actually shared some new information with me yesterday that I wasn't familiar with. Could you like quickly in a nutshell kind of explain the difference between the two, the virus and um, a normal bacteria that might cause you to get sick?
Okay. So um, to keep it simple and straightforward, because
Simple.
it can go deep, but to keep it simple, a bacteria, if you can remember the short clip that was on,
Yes.
bacteria float around between cells, okay, that you have in your body. And then you have bigger cells that are part of your immune system that will come around and they will find out like kind of the foreign invaders that are there, and they gobble them up and they just basically eat them and destroy them, like someone said yesterday, like man, chomping on the dots. Okay. So that's how bacteria works in the system. So they just kind of are moving around what they call intracellularly. And so the difference between that and a virus is a virus goes into a cell. It has components to it that allow it to attach to a cell, trick the cell into letting information in. It's almost like it has a carbon copy of a key if you needed to get into a locked room. Okay. But the key is not the original key. The door is not supposed to be open for that key, but the virus can trick the lock into saying, okay, you can come in. And then once the virus goes inside the cell, it's almost like if somebody came into your house and just destroyed it, rearranged everything, knocked all your furniture over, just completely wrecked what was inside your house. That's what a virus does inside the cell. And
Mhm.
so they go in, they change the DNA, the RNA of all the components that are inside the cell. And then it begins to say, okay, we did it here, let's replicate and let's do it again. And they start to attack different cells in your system. And so um, the virus is different than the bacteria because the virus will just jump, basically, for lack of better terms, from cell to cell to cell to cell to cell, destroying it and changing it and making it into a new viral cell, but for the most part. And that's how it starts to attack your system. And then it will destroy your body's defense system. So now it makes you susceptible to getting some other type of illness or some other kind of pathogen can kind of come in and now really cause even more damage to you because your body has been put into a weakened state at that point. And so that's kind of like the difference between the two. So there's not um, uh, a true medication or anything like that that can stop a virus the same way that you can take an antibiotic to stop the bacteria and kill off the bacteria that gets into your body. And so a lot of times people, I hear it a lot, mostly when it comes down to the flu. The flu is a virus. Influenza is a virus. And so people you hear will take an antibiotic when they have the flu, but the antibiotic doesn't, you can't kill the flu. It won't, it won't do anything because the flu's not affected by antibiotics because like what I said. And so that's kind of like the difference between those two components. And that's why it's best for your immune system as a whole to just be ready to fight for you regardless of what's going on, because if it has a better chance to fight for you, then your body can attack the virus. It can withstand the viral attack and kind of deal with it on its own power versus you trying to take something, because if you take something for the virus, it's not really going to work. You want your body to be able to fight for you. And that's where exercise comes in, proper nutrition, chiropractic adjustments, and just trying to live a lifestyle that put you in the best position just in case something were to happen. And so, and the example I use all the time is that the flu, when people get sick, um, the flu can take some people, weeks to get over if they're just dealing with it and they, miss work. So you're losing money, you're down and out, can't tend to your kids, can't do different types of things. And at the end of the day, you you feel terrible too. And so it shouldn't take 14 days for someone to get over the flu if their immune system is in its proper position to fight for you. And so, like, you can change that time frame if you just treat yourself right and let your immune system do what it can do. That 14 days, like, it can shrink down to just 2 or 3, and let your just take those couple days. You still can catch the flu. Take those couple days, but your body, if it's in a stronger position, okay, over if you happen to catch it on the weekend, like cool. Now you're down and out over the weekend, but you're back at work, you know, early in the week. You don't have to miss out on a lot of things that you would have if you were just in a different situation.
Absolutely, it makes sense, and it actually brings to mind another kind of interesting topic too. How stress can kind of how stress manifests in the body, what it can do, physically to you. And, it's well known how stress can make someone a little bit more vulnerable to getting infections and what it does to the immune system. how can stress, as a chiropractor, how do you see stress affect people physically, like what it does? Because, people tend to tense up and they breathe different under stress. And sometimes, if you got tight muscles, it pulls joints and bones in a certain way and what it can do. How do you see stress playing a big role in people's immunity and recovery and how you deal with it as a chiropractor?
Well, okay, so stress, you got to break it down into a couple different types of stress
Mm-hmm.
because your body's going to respond to all of it in a very particular way. So you can have physical stress, like if you, I don't know, you're jogging and you twist your ankle and you sprain it. That's a physical stress. There's a very particular response that's going to happen to cause swelling in that area. Different chemicals are released, different hormones are released to help manage that stress on your body. You could have chemical stress, such as if you are addicted or consume a lot of alcohol, nicotine from cigarettes, medications, like those are chemical stresses on the body. Or you can have mental stress, which is more of, if you're worried about situation like where everybody is in right now, or on a regular basis, you just have stress in your household, or you're worried about bills, or you're worried about dealing with a particular person, like at your job, all of those types of stresses um, can create basically a chain reaction for your body that has to have to deal with that stress to manage it. Because at the end of the day, your body always wants everything to be balanced. And so you have glands called your adrenal glands, which are nicknamed your stress glands in your body. And they are kind of the forefront that helps to manage any type of stress that's going on. And without getting into a whole long lecture, because I talk about this for a while, but the basic foundation of it is how does that compare to inflammation? Okay, because those stressful responses create hormones that get released because they are trying to find something to fix. And when it comes to physical stress, there's absolutely something that those hormones have to go fix because you sprained your ankle. So they got to go deal with that to control the blood flow in the area, to start the healing process. There's certain things that have to start to happen. When you have a mental stress, which is what I think you were asking initially, more about the mental part of it. Um, when when someone is thinking of something or they're worrying about something, then the adrenal glands are active in a fashion that they're not supposed to be active. Like they're in overdrive because they think that there's something tangible to go do, but it's just your mind is overactive. And so when you are stressed out like that, and you mentioned tight shoulders, and people carry, they say they carry their stress in their shoulders and they just tense all the time.
Mm-hmm.
So my job as the chiropractor is to, on the surface level, to help decrease that tension, which technically is the easy part. Like that's the simple thing to do with different types of therapy. I use my heat therapy, the adjustment, massage, the massages can help with that. And so like there's a lot of ways to fix that part of it. But if you don't fix what's causing that stressful response in the first place, then it's just always going to be a back and forth scenario, like all the time. It is just in a loop, in a loop, in a loop. So you have to um, sometimes find a way to manage stress that you have, because let's face it, stress is always going to be a part of our lives. You just have to know, well, what stresses can I control and which ones, do I just have to manage? Because there's a very big difference in both of those things. If you can't control it, then that means you just got to manage how you deal with it. Like if
Mm-hmm.
you have a job that you hate and you got a boss that's just always on you, then okay, if you're not leaving that job, you got to find a way to manage that so you're not so stressed out just going to make your living. And so you have to find different ways. Exercise is always great. Meditation is always great. Um, Long walks are good. Like you have to find something to deal with that, because when they come into the office to see me, for me to do the adjustment and to fix the physical part of it, that's pretty straightforward. And then all I have to do is just try and explain and give them some strategies that will help to kind of manage it, in between visits when somebody comes in to see me.
That makes sense. Um, it's just it's interesting to see, though. I mean, because especially during a time right now where everybody, well, people for the most part, I would say, a large group of people are worried about something and what's going to happen next. I guess the whole uncertainty of the situation causes so much more stress and so many more physical changes in the body, and trying to keep that balance is like such a big challenge right now for most people, especially people with small businesses and they have families and stuff to support. Just that what that does physically to the body every day. So it's like important to have an outlet to still do something, to still stay active. If you have a genius in your corner like yourself, to go still make sure you do visits with you and get adjusted. But it's crazy. It's interesting times right now, to say the least.
Yeah, definitely. I had a patient last week, a new patient, and she said she had marked on her form that she gets anxiety. So I started asking questions about that, and she mentioned, she's like, yes, sometimes it'll get real bad, and it's almost like I'll have a panic attack. And so I said, well, tell me about that a little bit. Like, what triggers it? What's going on? Is there something specific that's happening? And while we were talking, she just mentioned that she just gets this feeling that there's just something bad is about to happen, and she starts to have problems with breathing, and she feels like everything is just something bad is about to happen. And she's been going through this for years. And all I asked her was, what to me was a very simple question. Well, does something bad ever happen after you feel that? Like, what does something happen? Because I just want to know. And she stopped and she just looked at me and she said, no, nothing bad has ever happened. So we talked about that for a while, and we talked about, like, okay, well, when you start feeling a certain way, like you have to, one, recognize it, of course, and don't let certain thoughts just kind of just swoop in and take over and cause you a lot of stress, especially if there's never an outcome that you really need to be fearful of at the end of the day too.
Mhm. No, that's interesting. Because I know, with not me personally, but just with anxiety in general, when you create like this whole worry scenario in your head and you're creating all these things that are about to happen. So I was just telling someone the other day, it's like, in a way, you're kind of doubling the problem. It's like you're setting yourself up for your body to react the same way as it would as if it had really happened. Thus, if it happens, then you're putting yourself through double the physical stress that you would have if
Right.
it didn't happen. So it's like it's very interesting to see, or to like notice how that type of stuff plays out. And I know it's easier said than done for most people. You can't just snap your fingers and tell
Right.
somebody, like,
It
stop.
takes work.
Yeah, it takes work.
It takes a lot of work.
But when you kind of put it into perspective for people, it's like, okay, maybe I am kind of doing it. Why is this?
Yeah.
But similar thing. But Dr. Brandon, I know we can go like on and on for like days about different stuff, and we
Yeah.
definitely have to do this one again, because I have like a bunch of other topics we have to like cover and get out. But I appreciate you coming on this morning and joining me for a good convo,
No problem.
spreading the wisdom like you always do.
Thanks for the invite. I appreciate it.
Yeah, for sure. So when I get everything download and upload, I shoot you over the link. But if someone wants to get in touch with you, how can they do that, and where can they find you?
Well, it's not too hard. I mean, the website is just cobbpainandwellness.com. Office number 678-444-4154. And I'm online, so it's easy to reach out.
Okay, and for the record, you are currently working with only Eagles fans, Falcons fans.
Eagles fans get preference. They get preferential treatment. Falcons fans, we'll take them, but
All right, Dr. Brandon, I appreciate you. Until next
All right.
time, have a good one. Have a great weekend. We'll talk soon.
Okay, man. Take care.
All right, bye.